Hi, Sarah.
Hey, Emily.
How are you?
I'm so good. Well, I'm locked in my bedroom while my children are in front of the TV, so I'm great.
We're both in our bedrooms, Mama.
Yes,
Do what you
so
got
good to
to
see
do.
you. Yes, I know. So good to see you. I'm so excited about this. We got so many amazing questions.
Yeah. Oh, yes. Our community has sent in some awesome, awesome questions, and we are so excited to have you with us today because this is such an important topic, and
Thank you.
we're going to get into it. But for those of you who don't know Sarah, here's Sarah Reardon, also known as the Vagina Whisperer. You are a board certified pelvic health physical therapist and mama in New Orleans.
Yes.
And we're talking to you today about the topic of the pelvic floor and pelvic health, which is a topic that, unless you're that you talk about much.
Yeah.
And it's such an important area of the body that affects our entire health and well-being for all humans, but especially for pregnant mamas and mamas who have been pregnant and have given birth. And for me personally, I didn't know much at all about the pelvic floor or my pelvic floor or exactly where it was or what function it had until I got pregnant for the first time.
That's pretty cool.
Yeah. And I think that's the case for a lot of women. And my midwife was really the first one who broke it down for me. And I was shocked that I didn't know more about this incredible part of my body and the functions that it has. So that's what we're going to dive into today, which I'm super excited about. And somebody just asked if we can turn off the comments. Yes. Thank you for reminding me. We're turning those off so that we can see your face. But if you guys have questions, you can leave them in the question box. And we also have a lot of great questions to get into that I already have on my paper here that you guys sent in prior to this. And I'm so happy to see you guys on here because this is the good stuff. So first of all, what made you decide to start in this journey? Why do you do what you do?
Yeah, so I went to physical therapy school, like just traditional training, undergraduate and then postgraduate school. And I thought I was going to be a trainer for the New Orleans Saints. I was a runner and I wasn't into yoga yet. And I just loved being really active. But I think that there's something that as a woman, I was drawn to of, I kind of just want to understand this part of my body a little bit more. I didn't have any challenges. I just was like, oh, this is interesting. And so I did a residency rotation for a few months in Ann Arbor, Michigan, which just was an amazing opportunity to go to a really cool college town and, spend some time there. And I started doing women's health. And it's pelvic health. So I started seeing men and women together. And it was everything from peeing problems to pooping problems to pregnancy and birth and menopause. And I was just like, why isn't anyone teaching us about this? I mean, I just 3 years learning about our body and I got maybe this much on the pelvic floor. So I just loved working with the patients. I thought it was really amazing to help people with something they didn't know there was help for. And that just really impacts their life. We're all kind of walking around with these kind of secret problems that we don't talk about, but they're just really impacting our lives. So I've been doing it for 13 years. I love it. I mean, working with a vagina is like working with a foot. It's like just another part of the body. So for me,
a very important part of the body.
Yeah, it's a very important, and that's the thing. It's a really important part of the body.
Yeah.
And just like you, I mean, I, had 2 births. I had 2 pregnancies, and I was like, thank goodness I know all of this information. But what about everyone who doesn't? And that's really how I started the Instagram account. Was like, I just think everybody needs to know this, and we're not getting it from anywhere else.
Yeah, I mean, based on some of the questions that we got, it seems like there are a lot of mamas that first really hear about their pelvic floor in the middle of delivery when they're like, oh, it's too strong, or it's too this, or it's not enough of this. And they're just like, what could I have done differently? But you're already delivering your baby. So what do you do? So let's just start with really simple. What is it? And where is it?
Perfect.
Let's just
So
break that down first.
I've got my trusty pelvic model here for everyone to
There
see.
she is.
Yeah, there she is. And I think this is really helpful because we just realize that these are muscles and tissues like any other part of our body. So
Right.
this is your pelvis. I'm going to hold it up so that you guys can see. And this is the front part, the pubic bone, and then the back part, the sacrum and tailbone. So kind of like we're sitting, your pelvis sits just like this. But at the base of your pelvis is a ring of bones. And these, a basket of muscles. And these muscles really are like a hammock. And they support your pelvic organs. So your bladder, which holds urine, your rectum, which holds poop, your uterus, which holds a growing baby, all rest inside of here. And they're supported throughout the day. And then you also have these sphincters externally. So you've got the clitoris here, urethral opening where urine exits, vaginal opening for vaginal intercourse and vaginal birth, and then the anal opening. So, these external structures help hold in pee and poop so we don't leak throughout the day. And then during birth, you want to relax these muscles to allow a baby to exit the birth canal. So again, super important functions, but we often don't know what they do or what they don't do until they're not working for us. So maybe in the midst of birth, they're like, you need a push, and people don't know how to relax these muscles well, or the muscles are too tight and they're kind of not getting out of the way, for a baby to exit. So that's really where we see some problems come up during birth, and then also postpartum. I'm going to show this as well. So this is what we call the perineum, and this is the area between the vaginal opening and the anal opening. And that's typically the area where a perineal tear and episiotomy will happen. So common, very common, but again, something that we're just not educated on. It may happen. How do I, heal afterwards? All that stuff.
Yeah. And there's so much we can do. That's a positive part. There's so much that we can do prior and after birth. And also if you're not a mama or pregnant or want to be pregnant, there's so much we can do just for, pelvic health.
Totally.
Because we all need it and we all deserve it. Which we will get into, but I want to make sure that we touch on the fact that it is hard to talk about, which is why a lot of people don't mention it. If they have a problem, they're not sure who they should talk to. They're not sure why they're having these symptoms. And it can be embarrassing because we're talking leakage and all sorts of things.
Yeah.
And it's just something that a lot of people keep to themselves, and maybe they think it's normal or they just don't want to deal with it, and then it goes untreated.
Yep.
Let's talk a little bit about that, because I know that you've mentioned and you're kind of passionate about starting that conversation early in life with our children so that they know what this is and what can happen and what can help. Would you mind?
Absolutely. So, and this is something that I'm growing into as a woman and as a mother. Like, how do we educate the next generation? And I think that a lot of this is we just have to start talking about it. And these aren't going to be comfortable conversations. But if we don't start sharing them, then how can we get help? And I think sometimes even, we'll talk about motherhood a lot. And I really focus a lot on pregnancy and postpartum because I think that that's where a huge transformation for women can take place, but it doesn't go addressed. It's like we kind of are given this baby and it's like, see you in 6 weeks, maybe, and then see you maybe. So, and we're kind of left with, what do I do with this new body? And so, but I think one of the big things is if we start talking about it, it is destigmatized a little bit. It becomes like, hey, these are things that we're experiencing as women. And one, you're not alone, because the research is showing that, 1 in 4 women will experience painful intercourse at some point in their life. 1 in 4 female athletes in high school has urinary leakage. So we're seeing these things really young, but if we just kind of sweep them under the rug, they don't get addressed and then they don't get better. So, I'm pretty comfortable talking about this part of my body, but it's just taken me 13 years to you just keep doing it. And then you realize it's just another part of the body. But I also think that being in the medical field, I think that as medical providers, we need to do our due diligence to ask our patients these questions.
Right.
Yeah, and have the right resources for them. So, a brochure to do Kegels is not an appropriate, recommendation for somebody who just says, I'm peeing my pants, or I have pain with sex. Use more lube and drink wine is not the appropriate answer. Right. Which, so many here. So I think it needs to come from both sides. We need to do
Yeah.
our part in talking about it, but I think as medical providers, we have a duty to educate ourselves better and to have resources to refer women to.
Yes, absolutely. Well, you know, you're doing the work, so
I'm going to be on the soapbox for like the next 30 minutes.
amazing. So how do you know if you have a problem that is related to the public floor? That's hilarious. To the public floor. It doesn't have to be a public thing, although it's good to talk about it. What do we do about it?
Right. So I think that I always think it's really important to educate ourselves on what's normal so we know what's not normal. And so little things of like urinary leakage, not normal, chronic urinary tract infections, or feeling like you've got to pee after you just went pee, not normal. Peeing more than every 2 hours, you know, these little things that's not normal. So knowing what's normal, and then when you're outside of that range, it's like, okay, I need to do something about it. Same thing with pooping. I think the two things that I would want everyone to know, which I'm just going to dive into now, is how to pee and how to poop, which we do all the time. Your pelvic floor muscles are involved, but like yet nobody teaches us. So when you pee,
most of us don't do it right.
Right, correct. And that's how really problems arise. So when you pee, you should sit and chill. Like, don't push, don't strain.
Did you hear that, mamas?
Yeah.
So, like, give yourself a moment to pee.
Yeah. So thank you, Emily. Like, we're such, you know, we're so commonly doing that. Like, just sit and chill. Don't push your pee out. I call it power peeing. So because all that pressure over time can weaken your pelvic floor. Yeah. And the same thing with pooping. What's normal to poop is, you know, is 3 times a day to 3 times a week. So if you're going less often than that, you're probably straining, and straining can again cause more weakness to the pelvic floor. So, you know, don't hold your breath when you're pooping. Make sure I always say exhale like you're blowing up birthday candles, and use a squatty potty. So I religiously put my feet up on a squatty potty. So if you're doing those things, that can prevent a lot. And then problems will be leakage of pee or poop, you know, and also painful intercourse, pelvic pain, you know, pain with tampon insertion or pelvic exam. So those are all signs of like something's not right, something's not working properly. And then, you know, speaking to your physician or seeking out a pelvic floor therapy area just to get an assessment, and they can let you know what's working and what's not.
Right, because there must be different things that would be helpful to you depending on what your issue is.
Yeah,
I think you've said that Kegels are really not for everyone.
Correct.
So let's dive into that real quick, because I think a lot of people think, oh, it just means I need to do my Kegels every day, and then I've done the exercises, which I don't blame anyone for. I believe the same thing, because that's the message that is out there. Yeah. Your Kegels. Right. Why should some of us do those, and why should some of us not do those? Can we just dive into that?
Yeah. So, you know, Kegels are contractions of these pelvic floor muscles. So, you know, that basket of muscles, when you Kegel, those muscles should lift up, and those sphincters that hold in pee and poop should close. So we want those muscles to be strong, to keep in pee and poop, to have good sensation with vaginal intercourse, to support our organs. The thing is, though, is that a lot of people have tension in their muscles. So like myself, I have a lot of tension in my neck and shoulders, and I'll get headaches. The same thing can happen in those pelvic floor muscles. So if you're doing Kegels that are tightening those muscles, you're actually making your problem worse, because it's not necessarily what you need. You may need to work on relaxation and lengthening and softening those muscles before you do strengthening. So, and again, like you said, that's all we're ever taught is do your Kegels. And a lot of people aren't even doing them properly because, you know, it's a muscle we can't see. It's not like a bicep that we could flex.
Yeah, it's tricky.
Yeah, and it's not necessarily what you need. So that's why it's really an individual, like work with a specialist, get an assessment, and see if it's the right thing for you.
So the best thing, if you know that something is going on, the best thing to do is to find a specialist, a physical therapist, pelvic health physical therapist, and then figure out what is the right thing for you to do. And then
that's a very biased answer for myself.
Yeah, but I mean, it makes sense.
Yeah, plug for pelvic floor therapy. But I mean, think about it. We go to the OBGYN every year. We go to our internal medicine doctor. We go to our dentist. Like,
Right.
why are we attending to this part of our body that is going through so many changes over life and responsible for like some pretty important day-to-day functions?
Yeah. Shocking. I mean, just learning, you know, I think you and I talked about this in our phone call, that in France they have health insurance covers pelvic health or pelvic floor rehabilitation after birth.
Yep.
Because it makes sense.
Yep.
And that's not how it is over here.
Not even close.
Surprising, but you know, it's so like we have to take it in our own hands, and it's just such an important healing journey to be on.
Yeah. And, you know, one additional thing to that is I think the fact that, you know, when you give birth in other European countries and, you know, we know France specifically, you're automatically sent to pelvic floor therapy. So that's even just giving awareness to a new mom of like, hey, we know that these changes happen. We know that this is a problem. Let us get you to the right resources versus here. It's like maybe a 6-week visit during COVID, not even that. And then that's it. You know, so I think it at least just kind of gives the attention of like, hey, we know that you need some support after birth versus, you know, you get nothing.
Right. Which then again makes it normal. You feel like it's okay to talk about. It's normal. What's happening to me is normal, and there are solutions to fix it, rather than just living with it.
Exactly.
So what are some things that, you know, if we're not having obvious problems, let's say that we feel pretty healthy down there, what is something that we can think of and do every day to stay healthy?
Yeah. So that's a great question. So I think some of the things we mentioned already, like not straining when you pee, you know, making sure that you're pooping regularly. And again, I'm like a huge believer in the squatty potty, which is that little, you know, stool that goes under your toilet. So like, you know, the natural position for our bodies to poop is squatting. So, you know, we're sitting on these Western toilets and that's not helping our muscles relax. So, you know, being able to lift your feet up to poop and not straining. And then the other thing is with exercise, kind of learning how to engage these muscles with exercise. A lot of us are doing really high intensity exercise with CrossFit or weightlifting or running, and making sure that these muscles are strong and working well to meet the demands of that. And then on the other obvious things is like, we need to move. Like we sit all day in front of our computers.
Right
now we're all working from home. Like these muscles need blood flow. They're going to get stiff and tight. And so just going for walk breaks, going for breathing breaks, of taking some big deep breaths to let those muscles soften during the day so they don't get kind of locked up. I think are just really simple things to start doing.
What about sitting in that? I mean, I would try to show you guys, but I'm wearing a short dress, so let's not do that. But you know, like sitting in a squat, you know, like they do in a lot of Asian countries when they eat their food, they sit in a squat, in a low squat, and then they just eat their food. Is that something that is recommended to do a couple times every day, to just sit in that stretch?
Yeah, so that's a great question. And if you have tension, which a lot of us do, getting into that squat position is awesome. So I actually tell people to do it when they brush their teeth, because it's twice a day that they're just like hanging out for a minute and can get into that really low squat position.
That's awesome.
And that helps relax the muscles. So the only times you wouldn't want to do that is, you know, if you have prolapse or weakness already, that could maybe contribute more weakness, or if you have like pubic bone pain during pregnancy. But otherwise, it's like a child's pose. Yoga stretch is an alternative to that, but doing a deep squat is awesome. I mean, and that's how you keep your hips flexible, and all those things really help relax those muscles that can get too tense.
Awesome. Let's all squat when we start doing it. I'm gonna check in on you guys to see if you do it. Let's talk about pelvic health and breastfeeding.
Okay. Which people don't even know is a thing, like it's related. And so I mean, you're in this space. And so, you know, again, breastfeeding is something we just don't talk about enough. I mean, it's not, as intuitive as you would think. It's not as socially acceptable as you would think. And I really struggled with this. I think I was so focused on my birth and my pelvic floor. Obviously, I just didn't really even think to educate myself on breastfeeding. But some of the things that we see with breastfeeding is, I'm going to get a little nerdy on y'all right now, but when you are breastfeeding, your estrogen levels are lower. So if you've ever given birth, you know, like a couple days afterwards, you're like chills and sweats and shivering, and like it feels like you're going through menopause because your estrogen levels are plummeting. And that's to help your prolactin levels, your hormone levels increase, which is what helps breast milk production. And that's why you don't get your period for a period, you know, an extended period of time is when you're breastfeeding or lactating. So when your estrogen levels are low, it causes your your vaginal tissues to get thin, drier, maybe more fragile. And so with, you know, thinner, drier vulvar vaginal tissues, it can cause a lot of dryness. So, which can cause itching, irritation, and discomfort with intercourse. So, you know, when we see our medical providers at 6 weeks postpartum and they're like, thumbs up, you know, go back to sex, and there's like not a lot of education on how to do that, you may feel a lot of dryness. So one of the things I recommend is to proactively use a water-soluble lubricant. I like water-soluble lubricants because they just absorb into the tissues. They don't like hang out and potentially harbor bacteria. But I always say if it like glitters, sparkles, smells, don't put it on your vagina. Like just good old
keep that away.
lube. Right.
Yeah.
And then some people use coconut oil or olive oil, which are also
Right.
totally fine. But that just decreases friction. And then day to day, if you have dryness, to use vitamin E oil or coconut oil on the area. Just like we would moisturize your skin, you can do the same thing to your vaginal and vulvar tissues for dryness.
Yeah. That's amazing. So amazing. It's
Yeah. And that's the thing, is that it can cause pain with sex, but we may feel like that's normal, but there's things that can be done. And as you get, you know, as you're lactating less, as you're breastfeeding less, your menstrual cycle may come back, and then you may feel like your vagina starts to feel a little more normal.
Yeah.
And less dry.
Right. There's just so many easy things that can be done, that I'm so happy that we're talking about this. We have many questions that I would like to get to. So let's dive into it. The first one here is a woman who said, I am 2 years postpartum. Can I still do something about my pelvic floor?
Great question, common question, and absolutely.
Yeah.
We see it is never too late. I always say, like, we are postpartum forever. And sometimes at that 2 year mark that we're able to actually start giving ourselves a little care. We're kind of getting out of the weeds a little bit, and we're like, hey, I want to start taking care of me again. So, or get back to exercise, or so yeah, I mean, I've seen women decades after they've given birth who have issues. So it's never too late. And I think that if you feel like at 2 years, you're like, okay, I've got something going on, I'm ready to attend to it, like, then that's the time to go. Absolutely.
Yeah. I mean, this is something that we can do every day for the rest of our life, right? These simple things that we've talked about, to just, it could be a lifelong thing. Yeah.
I mean, if I could have it my way, I would see everybody once a year to check on their pelvic floor and just be like, okay, this is what's going on. This is, you know, we're changing, our menstrual cycles are changing. Then we start going into menopause, our exercise routines change, and your pelvic floor is affected by all of those things.
Yeah. Yeah. When is it time to seek a health professional when pelvic floor exercises haven't worked? And then another woman said, exercises did not strengthen my pelvic floor. I would love some tips.
Yeah. So this kind of goes into what we were touching on earlier, that it may not be the right thing for you. Right. So there's two things. Is a lot of us don't know how to do Kegel exercises properly. So the research shows that, you know, almost 50% of women, if they're told, hey, do your Kegels, and they're given a brochure, they may not even be doing them properly. So again, that one-on-one attention is really important. And two, it may not be the right thing. You may think that you need to be doing all these Kegels, but you may need to be doing relaxation work instead of just tightening, or you may need to be doing longer hold Kegel contractions instead of just, you know, quick ones. And the other thing is, you know, we have to train ourselves to use this muscle when we need it. So, you may be doing like Kegels in the carpool lane all day and be like, I'm doing my Kegels, but that's probably not when you're leaking urine or experiencing pressure or heaviness. So you've got to train the muscles to work in the movements and the exercises that you actually experience problems.
Mm. You know what? I actually found it hard after birth to even get it right. I remember thinking like, am I doing it right? It feels like I'm doing nothing.
Right.
To like do those Kegels. Like, I don't know if anything is actually happening down there because I can't feel much. So how do you know? How do you know if you're doing it right? And of course, this might be something that you want to bring up with your health professional. But can we just quickly talk about what correct Kegel is?
Right. So, and then it's total after giving birth, Emily. It's like radio silence down there. Like, these muscles have been
radio silence.
Radio silence. I'm like, I know where those muscles are, and I'm like, I got nothing, And so that's they've been lengthened over pregnancy. They've been lengthened over birth. Maybe had a tear. Like totally not unusual.
Yeah.
So a couple ways that you can tell, and some of them are a little less invasive than others, but. One way is that because these muscles hold in urine, when you are peeing on the toilet, you can try to stop your stream.
Mm-hmm.
That's a Kegel contraction. Now, I don't want everyone doing Kegels while they're peeing because your muscles need to be relaxed while you're peeing. But you can try that one time to try to stop and then see if you have the ability to hold that contraction.
Right.
Then you translate that to say, okay, that's the right exercise. And now you go do it when you're sitting or standing or walking or, other things. The other thing is you can use a mirror. So I actually have my patients, I have a mirror that I show my patients, like, I want you to watch what your muscles are doing. And it should kind of squeeze and lift up. Like you look at your hand, it lift up when you're contracting or doing a Kegel. And it should push out or flatten when you are bearing down to give birth or to have a bowel movement. And that's actually how I teach women to push properly, which is the opposite of a Kegel, pushing, to push when they're giving birth, because nobody teaches us that. So it's the opposite of a Kegel. So I can teach them how to use a mirror to kind of push, but then also do a contraction so that after giving birth, they know how to contract and kind of pull those muscles up.
Right. Oh, that's great. That's so great. Somebody else said, queefing, how to fix it. How do I fix it?
So maybe we should just say what queefing is. I'm assuming everybody knows, but queefing is like vaginal farts. So it is common postpartum. Yeah. And what happens is air gets trapped in the vagina, and when you move into a certain position, the air gets released. So it's like a vagina fart. It happens often during yoga, sometimes after intercourse. And so one of the signs
you can hear it too, which is what makes it.
Yeah, it's like a fart. It's like you can totally hear it. And that, really limits a lot of women because they don't want to go to yoga anymore because you can, it's an audible sound and it can be quite embarrassing.
Right.
So, I think some of the things, it's a sign that the muscles can be weak. So it's a sign that there is some tissue laxity and weakness. So teaching people how to do that proper contraction, going into the movement and going out of the movement so that air doesn't get trapped in there. Mm-hmm. So, and I'll have them practice that like at home. Say they're going into a down dog. I say, okay, I want you to contract that muscle and go into that movement, hold it, and then come out of that and teach them how to integrate that contraction into that they're having trouble with. And these things take time. Like, it takes 6 weeks for muscles to start strengthening. So I don't expect results immediately, but I teach people to start incorporating that contraction. So as the muscle gets stronger, it'll start to be more effective.
Right. Let's see. I think we already covered this. I want to read it anyway. One woman here said at delivery or during delivery, my doctor said my pelvic floor was too strong. I did not do exercises. So what could I have done differently? And that's one of those upsetting things again that, that's the first time anybody mentioned anything about that to her, that her pelvic floor was too strong in the middle of delivering her baby.
Yeah. I mean,
and many women don't do exercises. Like that's not why we're tense. Because I know I have a lot of tension down there as well. And it's not because we do the exercises. It's just how we're wired.
Yeah, it is. And just like for me, like I said, my tension is up here and I have
Yeah.
to get acupuncture and do yoga and all those things to help relieve that tension. And I think, what's really unfortunate about that is one, we're in such a vulnerable state when we are giving birth. And
Yeah.
it's confusing and it's exhausting and it's scary. And I think to kind of put that on a birthing person at that time is unfortunate from a medical provider's perspective. I think that, again, that's where it really comes into educating a lot of these medical providers about how can we better facilitate a better experience for birthing persons. And again, the other thing is, we want these muscles to be strong to support, the baby, but we also want to know how to relax them. And so I think when it comes into doing, how do you do it differently? I think that's where really we're seeing a lot of women come into physical therapy to say, hey, I want you to teach me how to relax these muscles, or assess if I have tension in those muscles. How can I relax those muscles going into birth, or do some stretches to help prepare my body? So just being a little, getting some being proactive going into birth. But also I think
Important.
if labor and delivery nurses and doctors know how to release these muscles, then they can also help the patients during the time. So it's not just on the patients, unfortunately.
That is very, very true. This is also a wonderful question. How long after birth is it not okay to still feel pressure down there like you're going to fall out?
Yeah. So when they're saying, are you going to fall out? They likely have pressure, heaviness. It feels like their bladder, their rectum kind of laying low, and it starts to kind of droop into the vaginal canal. I would say after 6 weeks, if you feel like you still have some pressure and heaviness there, then I would check in with a pelvic floor therapist and start getting an assessment and start working on those muscles. Again, common things are, it's really, a lot of people are constipated after giving birth. And then we're lifting, these muscles are vulnerable. We're not retraining them because nobody's told us how. And then you're lifting a baby, you're lifting car seats, you're lifting strollers, and all of that puts pressure on your pelvic floor. Right. So I would say at 6 weeks, kind of when you go to your postpartum visit, if you're still having those symptoms, even if they say like, give it more time, I would just proactively go in and see a specialist, 100%.
This one is interesting. She says, my doctor said I had to lose weight before trying to strengthen my pelvic floor or it wouldn't work. Is this true?
No. God, this is painful to hear these experiences that women have.
I mean,
I know. No, that is not the case. So there are some research studies that show that having additional abdominal weight can contribute to certain things like leakage or, prolapse. However, you can start at any body mass index, right, strengthening your muscles, just like you would any other muscle in your body. I don't think that that's a fair or appropriate response, and I'm really sorry that someone had to hear that. But no, I see women of all sizes, of all ages. I see people of all genders. We all have pelvic floors. So you can start at any time, and you don't have to wait. I think what I hear a lot from the medical community is like, wait to see if it gets better, or just try this first. I'm like, no, these are our bodies and we want to take care of them. And it takes so much courage for someone to say like, hey, this is going on. Like, let's give them resources instead of just being like, oh, let's come back another time or try this first. I think
it's heartbreaking.
I know.
I hope she's here. I hope she's watching.
Me too.
But I really appreciate you asking this question if you're here. Thank you for that. Here's a woman who says, my daughter was born 2 years ago. I did pelvic floor physiotherapy. I still lose a tiny bit of urine when I sneeze. Help, she says.
Well, one, yay, you did pelvic floor therapy, which is amazing. And so one of the things I teach people is, again, we talked about this, like if you, one, that's a sign that your muscles aren't quite where they need to be. So, after 2 years, a lot's changed. I would even just go back in and be like, hey, I'm still having this problem. Two is you have to use the muscle when you need it. So do that Kegel contraction before a cough or before a sneeze, because you need to turn those muscles on to prevent the pressure from the cough or sneeze. So it's not just about doing Kegels, it's about using that muscle when you need it to work. So do the Kegel contraction before coughing or sneezing. And that's for all of us. Like,
yes.
Yeah.
I can
I mean,
totally relate to that. That was definitely a big issue for me.
yep.
Which then makes me think, because I think one thing that helped me was I do a lot of gosh, words are not coming today. The rebounder. So the
Oh,
bouncing
yeah.
has been really helpful. I don't know
Really?
if you talk to patients about that at all.
Is that like the little trampoline that you're
Not
jumping on?
trampoline. It's
Yeah.
called, yeah. The woman that I learned it from, she calls it rebounding. So you just like you bounce on it, and it's supposed to strengthen the pelvic floor. And for me personally, I think it helped.
Okay.
I don't
That's
know if
awesome.
you have any advice
So
on
it's
that.
interesting. 'Cause I had a patient who started doing it and started having more problems afterwards because
Interesting.
of all the kind of pressure down. So, but I
Yeah.
think if you're engaging properly, again, if you have that, if you're turning those muscles on and know how to turn those muscles on and being coached properly to do that, then it can actually be helpful because you're
Yeah.
teaching those muscles to support against the pressure of jumping.
Right.
But if you're just jumping, like a lot of us can't do jumping jacks or can't run because of all the pressure.
Yeah.
You've got to train the muscles to lift up. And I'll give everybody like a little backdoor secret. When people do have leakage with jumping and they're working on their pelvic floor, but it's not where it needs to be. I actually tell them to use a tampon while insert a tampon into the vagina, or there are these little supports called poise and preza, but the tampon just gives their vaginal walls a little more support. I think a lot of this is
Oh.
like, yeah, so it helps, like, so the bladder's not pushing down as much, and the tampon gives a little more support to the walls if the strength isn't there yet. So it's a
God.
little like, I tell people to do it because I want them to be active. I want them to
Yeah.
run, exercise, but I don't want them to feel like, okay, do I just go and pee my pants, or is there something that can help me as I'm strengthening until I get stronger?
Yeah, that's a really great tips, the tampon. And then of course also you can use a pad, if you're afraid of like
Yes.
you can, just to feel more comfortable. I've done that. Are pelvic organ prolapses reversible?
Yeah. So I'll describe what pelvic organ prolapse is. So again, that basket of muscles, your pelvic floor supports your organs, and when that basket gets lengthened or stretched out, it's like the hammock sinks a little bit lower. So so the contents of the hammock, which are your bladder, your rectum, your uterus, starts to sink a little bit lower, and so it feels like you have pressure or heaviness, or something's falling out of your vagina. So yeah, the research is showing that we can improve pelvic organ prolapse by an entire grade. So we graded like 0 to 4. 1 and 2 are kind of above the vaginal opening, and 3 and 4 like when your organs start to kind of droop out of the vaginal opening, and that would be a surgical candidate. But if you're at that level above the vaginal opening, you can totally improve it by at least a grade. So with exercise, with modifying activity, I tell people to lie on their back and put a pillow under their hips every night, kind of like in a bridge pose, and just to kind of give those muscles a little bit of rest because they're working all throughout the day to support your. But you can reverse it, absolutely.
That's great. This is the last question that I have here. And we talked about it a little bit, but she's asking what pelvic floor exercises are best to do during pregnancy. I know we have a lot of pregnant mamas watching now probably. So let's just go over that. What can be really good to do when you're pregnant?
Yeah, so so 2 things I think are really important during pregnancy is thinking about where you are in your pregnancy. So in the first and second trimester, exercise is still wonderful. It's great. And that's where I think we focus a lot on strengthening. So, doing those pelvic floor, or we call them transverse abdominal contractions, where you kind of hug your belly in with the pelvic floor. Doing that day to day and incorporating that into your exercise. If you do HIIT workouts, if you do bar, if you do yoga, kind of making sure that you're hugging that belly and bringing pelvic floor into the activities. And the third trimester, I like to focus a lot more on relaxation, softening the muscles, opening the pelvis to help your body prepare for birth. Again, we don't want you going in with these super tight pelvic floor muscles. We want to focus on that relaxation. And that's also the stage where we just start to get a little more uncomfortable. So I think it's okay to do a more yoga-based program, get into that deep squat position like we talked about a couple times a day, and learn how to push and relax the muscles. So pelvic floor contractions, lower abdominal contractions, and then breathing. So I teach a lot of diaphragmatic breathing where you really open up the belly and then you can kind of hug your belly in and do that core contraction after that.
Yeah, that's great. I'm looking in the question box here. I've had issues with it before. When I click on it, it actually joins our screen and the question is open on our screen. I don't want to do that because you can see the people's faces. I'm afraid that that error is going to happen again. But I see the beginning of their questions, and there are quite a few ladies here asking about, let me just open it up again. Pain during intercourse.
Yeah, that's a great
But a
one.
lot of women are struggling with that. And I'm not, like I said, I can't read their specific question, but can we talk a little bit more about that? Why that is and what can be done? Because it is happening to a lot of women.
Yeah, and it happens to some women even before giving birth, and it's especially common after giving birth.
Yeah.
So it's not normal. Pain with sex is not normal. Sex should be pleasurable and enjoyable and not just tolerable and something that you feel like you have to just like push through. So I think that that's the first thing that I tell people is like, just know what's normal so that when something's not comfortable, you're like, okay, this isn't normal. Again, something we may not talk about and may feel really embarrassing to be like, I actually don't like it, or it's really painful, or you don't have it. So I think that's the first thing is that it should be painful. And there's two things, actually there's a couple things that can happen. One, you can have discomfort or pain with initial insertion. So when you're, I'll bring up my trusty model. Yeah. So when you were first trying to insert something into the vaginal opening, if you have pain right away, it could be, if you're postpartum, it could be scar tissue, it could be muscle tension. Again, these are muscles that can get tight, or it could be some vaginal dryness. So those are probably the more common ones. If you also, with deeper insertion, you can have pain. So, you know, certain positions, or just as someone penetrates deeper, they can have pain. It feels bruisey. It feels like they're hitting something. And that is typically muscle tension. You know, just like you would press on a little sore spot in your neck and it feels tender, it's the same thing to these muscles.
Yeah.
So, again, it's muscle tension. Nothing's wrong with you. Nothing's broken. You're not going to hurt yourself, except it's painful. And so working with a specialist to learn how to relax those muscles. We do intravaginal, I hate to call it massage, but it's like a trigger point release to decrease tension to some of those inside muscles and to some of the outside muscles. But it's not something you just have to deal with. There's definitely things that can help. And it's common after cesarean births as well. You know, there's a lot of restriction in the abdominal wall and the fascia after cesarean birth. So we see a lot of cesarean birth moms with pelvic floor issues as well. So yeah, those are all the things. But again, muscles, tissues, dryness, scar tissue, all those things.
Yeah. So let's talk about where and how to find a pelvic health physical therapist in your community.
Yeah. So outside of Google, so you can always Google, but there's a couple different ways. One, I think one of the best things is word of mouth. If you feel comfortable talking to a mom's group or a girlfriend saying, hey, have you heard of anybody who does this in the area? Because I think word of mouth is just one of the best ways to kind of vet who is good. The second way is asking a provider. So, you know, we work a lot of, and not just medical providers, we work with acupuncturists, nutritionists, postpartum mental health therapists. I mean, we have a really doula group, you know, we've got a great group of doulas that we work with and midwives. So they're really going to be, those birth workers, I think, really have a good pulse on who's in the community and who could be helpful to some pregnant and postpartum clients. And then there are a few directories. So on my website, which is thevaginawhisperer.com, at the very bottom, it says PT Locator, and you can go on there and just type in your zip code or type in your city, and it will put the pelvic floor therapists that are in your area.
Oh, that's awesome. That's really, really great. Sarah,
Emily,
amazing. This is so important.
I could talk about this all day. So
and we should talk about it all day. You have 2 kids. I have 2 kids.
I know.
This was so great, and thank you, all of you, for your amazing questions. And we'll keep this conversation going. Maybe we get to have you back someday and continue this conversation. We really appreciate your time and your knowledge and your passion when it comes to this.
Yeah, and thank you everyone for your questions, for
Yeah.
your time. I mean, again, we just like being able to share this information, I think is so powerful. And I think it's something that, you know, can only benefit us. So I appreciate you sharing your platform.
It starts with the brave questions, and we definitely had some. So we can find you. You said the vaginawhisperer.com.
Yeah, so I'm clearly on Instagram as the Vagina Whisperer, and then my website is thevaginawhisperer.com, where, you know, we do online sessions as well for people who aren't in our New Orleans community, and then just have some pregnancy postpartum resources and blogs and courses and stuff to help all over.
So follow Sarah. Let's squat when we brush our teeth. I know I am.
Yeah.
And thank you so much again. We hope to talk to you soon.
Thank you. Thank you, everyone.
Bye everyone.